All right, Senator Reiner, SB 107.
Thank you very much, Mr. Chairman, and I want to thank the committee and staff for the thorough analysis of this bill. SB 107 is back on concurrence after the House of Origin deadline to introduce bills in this body. The governor of Texas issued an executive order indicating that if a parent allows their child to receive gender-affirming care, that would be considered child abuse under state law, and the child would be removed from the household, put in foster care, and the parent would be criminally prosecuted. This started a chain reaction, as is so often the case with transphobic and homophobic red state legislation, where quickly Alabama and other states introduced legislation, and some of it passed in Alabama. The law indicates that a parent consenting to a child receiving gender-affirming care is guilty of a felony punishable by up to 10 years in prison. In addition, the physician would be subject to criminal penalty of 10 years in prison. So we immediately went to work, say, how can we push back and make clear that California is not going to be a party to these laws? And that is where SB 107 came from. This bill does a few things, and its general gist is to send a signal to trans kids and their families that if they do not feel safe, or if they are under attack or threat of criminal prosecution in their home states because they allowed their child to receive gender-affirming care, that they can come to California, and we will do what we are legally able to do to give them refuge and to protect them, and we're not going to become an arm of law enforcement of the state of Texas or Alabama or other states. So the bill does a few things. First of all, it makes clear that California courts are going to, when there are in these kinds of situations, we're going to apply our own law and not the law of these just abusive, despicable laws from these other states. We are not going to honor subpoenas from those states for example, medical records relating to gender-affirming care, in order, if those subpoenas are to facilitate those laws in a criminal or civil context. And law enforcement, unless we are constitutionally required in terms of extradition, that we are not going to participate from a law enforcement perspective in enforcing the laws of these other states, and that it will be deprioritized in terms of level of law enforcement participation. We have a broad coalition behind the bill. The bill is co-sponsored by Equality California and Planned Parenthood. There are an enormous number of LGBTQ youth, and particularly trans youth throughout this country, who are literally in a state of terror right now when they see that powerful elected officials are basically denying their existence and are signaling to these children that because of who you are, we're putting you in foster care and your parents are going to prison. And is it any wonder that the rates of suicide are so high among these kids? And that's why it's critically important for California to stand up and say that we're not going to be a party to that. And I respectfully ask for your aye vote.
All righty. In support, we have,
I'm sorry, and with me today, my apologies, Mr. Chair, to testify are Tommy Martin from Equality California, and on the phone, Kathy Molig from Trans Family Support Service.
All right. Tommy Martin, the floor is yours.
Thank you, Chair and committee members. Tommy Martin on behalf of Equality California. We're a proud co-sponsor of SB 107. And for many months, we have worked diligently on this bill, which is both highly functional and highly symbolic. In terms of the function, no doubt you have read in the news the extent to which legislatures and politicians across the country are working to invalidate and repress transgender people and the families and doctors who support them. These attempts are part of a broader effort to invalidate marginalized populations and rob people of autonomy over their own lives and their own bodies. As the comprehensive analysis rightly notes, many of these anti-trans laws and policies are not limited in geographic scope, which is why SB 107 serves the critical function of ensuring, as much as we can, that California will not enable other states to punish people who are in our state for the purpose of obtaining gender-affirming care, which is lawful here. Beyond what the bill does, I also want to highlight what the bill means. As an LGBTQ+ person and as one who works in the legislative space, it has been hard to watch leaders in other states use legislation and policy to harm my community and to hurt my friends. We can measure the harm that these political debates have on LGBTQ+ youth and trans youth in particular. On the flip side, we also know that these pro-equality policies help trans youth, who, no surprise, fare better when their communities support them rather than legislate against them. SB 107 is a demonstration of that support, and it will help. So in closing, we are grateful to our many legal and community partners who have informed this effort. And since this is my last opportunity to speak on the record on this bill, I also want to thank Senator Wiener for leading on this. He has had courage when we have been afraid and has been a tireless champion for the LGBTQ+ community, though I have no doubt that he is just as tired as we are. SB 107 is also all of these things and more for our community. So we are incredibly proud to co-sponsor SB 107 and respectfully urge the committee's support as well. Thank you.
Thank you. Ms. Martin. All right. Kathy Molig, are you here or on the phone?
On the phone.
I'm on the phone.
All right. Go ahead.
Thank you. My name is Kathy Molig. She, her are my pronouns. I'm the founder and executive director of Trans Family Support Services and the parent of a trans youth. While we're based in San Diego, we served over 3,000 trans youth and their families across the country with a chapter in Alabama. Recently, Alabama passed a law that criminalizes trans-affirming care for those 19 and under. As you know, Alabama is not the only state with this harmful legislation. This law is devastating to our youth and families. The rate of anxiety, depression, self-harm, and suicidation among this population is so very high, especially for those who can't access appropriate medical care, which is the only treatment for gender dysphoria. As a parent of a trans youth who couldn't find any medical care over a decade ago in San Diego, I know the feeling of hopelessness and helplessness. I watched our Alabama families struggle at a recent Zoom meeting, trying to figure out what they would do next to keep their kids on their medically necessary treatment, even if this means traveling to a different state or even moving. Some states have gone as far as trying to criminalize parents traveling to other states for this care. Trans Family Support Services is currently serving many families affected by this hateful legislation. Several of these families are already connecting with us, talk to medical professionals here in California to treat their youth, and others have even moved to California already. I know I would have gone anywhere and stopped at nothing to get my child this life-changing and life-saving care. Currently, approximately 56,000 trans youth are living in states that may lose this medical care. This bill will bring comfort and confidence to those very vulnerable families to have a safe place to obtain their youth's medical treatment. Today, I bring the voices of thousands of trans youth and their families as a co-sponsor of this bill and to urge you to support SB 107. Give them the needed relief to obtain care in California without fear. Our transgender youth deserve to live full and happy lives. Please protect trans youth.
All righty. Thank you, Ms. Molig. Next, those who wish to testify in support of SB 107, if you would approach the microphone, give us your name, your affiliation, and your position.
Chair and members, Catalina Sanchez with Corbin and Kaiser on behalf of the Electronic Frontier Foundation and support. Thank you.
Thank you.
Hi, Molly Robeson with Planned Parenthood Affiliates of California. We're a co-sponsor and strong support. Thank you.
Hi, Evan Minton, a transgender individual and the co-chair of the Lieutenant Governor's Transgender Advisory Council, here in strong support of this important measure.
Thank you.
Hello, Genesis Gonzalez on behalf of Lieutenant Governor Lenny Kounalakis as a proud co-sponsor and support. Thank you.
Thank you.
Chair and members, Kathy Mossberg with Essential Access Health in support.
Thank you.
Hello, here on behalf of San Mateo County Board of Supervisors in support. Thank you.
Ari Steinberg on behalf of California Nurses and Midwives Association in support. Thank you.
Erin Evans on behalf of NARAL Pro-Choice California in support. Thanks.
Thank you. Seeing no one else approach the microphone, moderator, let's turn to the phone lines. As I mentioned at the outset, 15 minutes for each side of Me Too testimony on the phone.
Thank you, ladies and gentlemen. To speak in support of SB 107, please press 1, then 0. And first, we will go with line 87. Please go ahead.
Craig Bolster on behalf of APLA Health, strong support.
Thank you.
Thank you. Line 68, please go ahead.
Becca Kramer-Mauder on behalf of ACLU California Action and Support.
Thank you. Moderator, anyone else in support? Moderator? Testing 1, 2, 3. Moderator, are you with us? All right. If we're having technical difficulties, why don't we pause the support on the phone line, and we'll come back to support on the phone line, and then turn to opposition. I understand that we have two witnesses in opposition, Chloe Cole and Aaron Friday, that are here, I'm told, here in the hearing room. All right. So what we're going to do is we're going to hear from the two of you, 2 minutes each, and then if we're reconnected, we're going to go back to the phone lines to finish support for SB 107, then come back to opposition. So, floor is yours. Go ahead.
My name is Chloe Cole. I'm 18, and my story is not hyperbole. Starting around the age of 12, I began to believe that I was transgender. This belief was not organic. All the media I consumed as a kid showed me how stupid and vulnerable being a girl was. All the sexualized images of women gave me an unrealistic expectation of womanhood. I spent a lot of time online and quickly saw all the praise coming out of trans God on Instagram and other social media. I was a bit awkward in school and had some trouble making friends. Like many dysphoric children, I also suffer from a variety of mental health conditions, so I easily fell prey to the narrative that if I felt different and did not want to be a highly sexualized girl, I must be a boy. I obsessed over becoming a boy. I believed that all my insecurities and anxiety would magically disappear once I transitioned. The mental health professionals did not try to dissuade me of this delusional belief. I was fast-tracked into medical transition after I was diagnosed with dysphoria. In California, a child can pick their gender identity, and a care provider questioning that would be considered conversion therapy. This wasn't a misdiagnosis. It was mistreatment. My parents were told that the options were transition or suicide. They complied because they were not offered any other treatment solution for my distress. My distraught parents wanted me alive, so they listened to my doctors. I was placed on puberty blockers and testosterone after expressing my gender dysphoria to my therapist, and I was approved for a double mastectomy all by the age of 15. No one explored why I did not want to be a girl. More and more kids are falling for the false promise of happiness if they transition. Gender clinics in the U.S. are turning a blind eye to European countries who are pumping the brakes on this experiment on youth. Who here really believes that, as a 15-year-old, I should have had my healthy breast removed, or that it should have been an option? When the CDPH got less than 300 reports of people getting hospitalized as a result of vaping. San Francisco banned vape products that same year. So I know that you care about the health of children, yet you are allowing doctors all over the state to remove the healthy breasts of children. How many more children's bodies will be destroyed before you actually listen? What is the sweet spot? 100? 200? 1,000? SB 107 will open the floodgates for confused children like me to get the gender interventions that many so regret. I am the canary in the coal mine.
Thank you. Ms. Friday?
Good afternoon. I'm an attorney. My daughter thought that she was transgender for 2 years, but changed her mind. Thankfully, I did not medicalize her. If California wanted to provide a refuge for only families that unanimously agree to gender interventions, it did not need to amend the Family Code. Family Code Section 3421D provides the presence of a child in this state for the purpose of obtaining gender-affirming health care is sufficient to give California courts the right to make initial custody determination. So if an out-of-state child gets to California, California decides which parent, if any, gets custody. Normally, pursuant to the Interstate Compact for Juveniles, California courts would send that child back to her home state. This law entices minors seeking gender interventions against their parents' wishes to run away to California. California Section 3420, or Family Code Section 3424A states, a court of this state has temporary emergency jurisdiction if the child is present in this state because the child has been unable to obtain gender-affirming care. So if parents disagree on whether or not to permit their 14-year-old daughter to have her breasts removed, and the assenting parent and child arrives in California, California will decide which parent gets custody. We parents know who will win that battle. Pursuant to Family Code 3428, it is not kidnapping if the non-custodial parent absconds with the gender-confused child to California. This is the plain language of SB 107. Ask Senator Wiener how the law affects out-of-state parents who disagree about subjecting their child to medical treatments when one parent gets to California. Ask him if the law permits California to ignore out-of-state custody agreements. Ask him what would have happened to my child if my husband wanted to medicalize her.
Alrighty, thank you very much. We'll now turn back to the phone lines, if the phone lines are now intact, for those in support of SB 107. Moderator, are you present? Moderator? All right, well.
Yes, I am here. It'll be line 68.
All right, thank you.
And I apologize. The next line will be line 92.
Hi, this is Brenda Villanueva with the Los Angeles LGBT Center, and we strongly support SB 107.
Thank you.
Thank you.
Thank you. And our next line will be 86.
Yes, John Lovell on behalf of the Coalition of Public Safety Officer Support Services in support of Senate Bill 107.
Thank you.
Thank you. And we will go to line 78.
Hi, my name is Cassidy Wells. Gender-affirming care saved my life. It is not new. It is not experimental.
Thank you. Your name, your affiliation, and your position.
Cassidy Wells. I strongly urge you to support this bill.
Thank you.
Thank you. And we'll go to line 76.
This is Laura Thomas with the San Francisco AIDS Foundation in strong support of this bill. Thank you.
Thank you.
Thank you. And we'll go to line 104. Your line is open. And there are no further lines in queue.
All right. Now we're going to turn to those in opposition here in the hearing room. So if you're in opposition to SB 107, please approach the microphone. Seeing one person approach the microphone.
Hello, everyone. Jonathan Keller with California Family Council, respectfully asking for a no vote.
Thank you. All right. Seeing no one else approaching the microphone, let's turn to the phone lines for those who are opposed to SB 107.
And we will go to the line of 99. Your line is open.
99? Yes. I'm a psychiatrist and have read
your name, your affiliation, and your position.
Okay. Sure. My name is John Rainey. I'm a psychiatrist, and I have concerns.
Okay. Thank you, sir. Next caller.
Thank you. And our next line will be 88. Line 88, your line is open. We will go to line we will go to line 84. Your line is open.
Hello?
Yes, go ahead.
My name is Oksana. I am a mother of a deceased child, and I oppose this horrible and poorly written bill.
Thank you.
Thank you. And our next line will be 104. Line 104.
Is this me?
Yes, it is.
Okay, thank you. My name is Lydia McLaughlin from Santa Clarita, California. I have a transgender youth. I strongly oppose SB 107. Thank you.
Thank you.
And there are no further lines at this time.
All right. Let's bring it back to committee. Questions by committee members? Yes, Senator Wachowski.
I'm trying to understand the balance between the full faith and credit clause and the extradition clause. And if I have a couple of examples, if I could get an answer. It seems to me, and I understand the messaging on this, or the impact that the symbolic effect that this would have, even if some of these elements are determined to not be enforceable. It seems to me clear that if you're a healthcare provider in California and a youth comes into California and a doctor's giving advice and it's the activities having in California, then California's laws protect that. So actions by other states to subpoena records and pull out and pull people out to be prosecuted in Texas or someplace, at least the staff report indicates that we're on pretty firm ground. Would you agree with that?
I think so, but I'll be honest, and this is one of the reasons why this bill is so important, is because we're seeing all these different laws in a lot of different forms getting passed in these other states. Some are being put on hold by the courts, they're being appealed, et cetera, et cetera. We don't know how it's going to shake out. And some of these laws, and we're seeing it in the abortion context too, what they're proposing is to be able to reach into the other states. That, in other words, if you, whether it's around abortion or gender-affirming care, leave the state as a resident to go to the other state to do that, for example, saying that if a parent takes their child across state lines, even though the actual medical procedure is in the other state, that is a felony in the home state. There will be a legal fight about that, of course, and I don't think they can do that, but they're certainly going to try to do that because they have no boundaries in terms of the restrictions they're trying to place on people's lives. In terms of extradition, there are two types of extradition. If the crime is committed in the state that wants extradition, that's trying to pull someone back, we have certain obligations under the U.S. Constitution. If it is not so clear that it took place in that state, if it was in another state, then it can often be discretionary for that state. So those are the two types of.
Because that was another follow-up question, Mr. Chair, is that if they fled their state where it's illegal, let's just say that, and then they go to a neutral state, and then they come to California, and we're trying to provide a safe harbor, then those subpoenas or court extradition orders that would come to California law enforcement would put us on firmer ground to say, well, wait, they're seeking protection here in California, and that act did not occur in the issuing state.
I mean, the more attenuated, the weaker their grounds are. But what we're trying to do is we don't want to violate the U.S. Constitution, and nothing in this bill does. Someone, of course, can contend whatever they want in the courts. We try to be very careful not to violate the Constitution, but we want to go right up to the boundary where we legally can go to say, without violating the Constitution, we're going to do whatever we can do to say we are not going to be a party to your laws, we're not going to enforce these terrible laws, and we're not going to become an arm of Governor Abbott or whoever else is engaging in these attacks.
And in the area of like telehealth or crisis center, people call in for advice, or people want to consult with a doctor that's here is sitting in California. Again, I feel like I'm in law school again. Here, our laws in California are to protect the people that are here physically in the state of California. what's your thinking on that as far as a sheriff getting a subpoena from some judge in Texas saying this healthcare provider that never left the state of California is to be, the records to be turned over and they're supposed to be extradited?
In terms of the subpoena, I think the bill would preclude that, that a subpoena from being honored. In terms of the extradition, I think if they're going after the medical provider was in California. I would think that would be discretionary extradition, but of course the courts would ultimately be the ones to make that decision.
And then finally, if a California medical provider or a crisis management person actually leaves the state and goes and provides the services or the information in that state to that person, even though they're licensed here in California, and then they come back, that's on shakier grounds as far as our ability to protect those people within the law.
Yeah, although the bill is also designed, it's not just for people who receive services in California. So if parents allow their child to receive gender-affirming care, let's say in Texas at this point has been shutting down all those clinics, but let's say there is a clinic and they get care there, and then the state is like, we're going to prosecute you for child abuse. If they come to California, we will still do what we can under this bill to protect them. We may have limits under the U.S. Constitution, but we were going to go right up to the edge of what we're able to do to protect them and to say, unless we are absolutely forced to send you back, we are not going to send you back.
Thank you, Mr. Chair.
So thank you, Senator Wachowski. We're going to come back to questions and comments by committee members. Apparently, because of a technical issue, we cut off those who wish to provide some Me Too testimony on the phone line. So, moderator, if we could go back, as I mentioned at the outset, 15 minutes per side. So, if we could go back and if the caller would give us their name, their affiliation, and their position. All right.
Certainly, and we will go to line number 30.
Yes.
Yes, you're on.
Can you hear me?
Yes, we can.
Just vehemently. This is nothing but breaking up families.
I'm sorry, ma'am, your name, your affiliation, your position.
I am.
All right. Moderator, if we go to the next caller.
Certainly, our next line will be line 20.
Hello?
Yes, you're on.
Hi, my name's Phil Stanton. I'm a parent, and I strongly oppose this bill.
Thank you.
Thank you. We'll go to line 38.
Hi, my name is Gigi LaRue. I represent Our Duty. I'm a parent of a trans-identified child, and I strongly oppose this bill.
Thank you.
Thank you, and we will go to line 109. Line 109. We will continue on to line 28.
Hi, yes, this is Julia Donnelly. I am a parent of a trans-identified youth, and I strongly oppose this bill.
Thank you.
Thank you, and we'll go to line 26.
Paul Tucker. I'm a parent, and I strongly oppose this bill.
Thank you.
Thank you, and we'll go to line 57.
Hi, my name is Dee Dee Williams, and I strongly oppose SB 107. I'm a mother of a son who thought he was transgender for years and then realized he was just gay.
All right. Next caller, please.
Thank you, and our next line will go to 51.
Hello, I'm a parent of a trans-identified youth in Sacramento, and I strongly oppose this bill.
Thank you.
Thank you, and our line number will be 106.
Hello, my name is Ellie Swimmer. I'm a Democratic parent of a trans-identifying child. I strongly oppose.
Thank you.
Thank you, and our next line is 31.
That would be me. Hello. I am sick and tired of...
All righty, thank you. Name, affiliation, position.
Our next line will be 88.
Right. Thank you.
Line 88, your line is open. We will continue on to line 44.
Hello, my name is Ted Dudakos.
Contra Costa County. I strongly oppose this bill. I'm a parent of a trans-identified youth who was chemically castrated by the...
All right. Thank you, sir.
Thank you. And our next line will go to 115.
Mr. Chair and members, Sylvia Solis Shaw on behalf of the City of West Hollywood in strong support. Thank you.
Thank you.
Thank you. And our next line will be 111.
Lily Dean, I'm a parent of a gender-confused youth, and I strongly oppose. I'm with Silicon Valley Chinese Association Foundation.
All right. Thank you.
Thank you. And our next line will be 116.
Hi, this is Renee Yastamura. I'm a former Democrat and parent of a teenage detransitioner and strongly oppose 107.
Thank you.
Thank you. And our next line will be 112.
Hello?
Thank you. You're on.
112.
Hi, my name is Lavon Urbano. I'm a parent of a child who's trans-identified recently. I strongly oppose SB 107.
Thank you.
Thank you. And our next line will be 88. Your line is open.
Is that me?
Yes, it is.
You can hear me?
Go ahead, ma'am.
I'm Chris. I'm a parent of a gender dysphoric child, and I oppose this bill.
Thank you.
And there are no further lines in queue.
All right. Thank you, moderator. Bring it back to committee. Other questions or comments by committee members?
Move the bill.
Senator Wachowski moves the bill. Senator Wiener, care to close?
Thank you, Mr. Chairman. I appreciate the discussion today. You know, it's really tragic that there is trans kids have become a political football by some very, very cynical politicians who, on the backs of these children, are trying to make a name for themselves in politics, climb the way up the ladder, whatever it is that they want to do. That has profound consequences for the lives of these children. It wasn't that long ago, and I say this as a gay man, that members of my community, gay men, lesbians, were told at an early age, you aren't who you say you are, you're just going through a phase, stay in the closet, we're going to put you in conversion therapy, whatever the case may be. And that's still happening today, by the way. And now we're seeing with trans kids this narrative that you don't exist. It's fake. It's a phase. You're being manipulated. We see it with the bathroom bills, that if a trans woman wants to urinate in a women's restroom, she must be faking it to scam her way in. We see it with athletes, where, you know, if a trans young woman wants to run cross country on the women's team, she must be faking it to get an advantage. When you get all the headlines, negative headlines, when a trans girl or young woman wins, instead of praising her for winning, it's an attack because she must be a scam artist, while ignoring all the times that cisgender women beat the trans women in athletic contests. We see it in the prison setting, where we passed a groundbreaking law here a few years ago to the trans women who are at such extreme risk of violence in men's prison, giving them the opportunity to be housed in a women's facility. And all we hear about is that they're all supposedly fake scam artists just trying to get their way into women's prisons. This is a community, these people are real. They are real human beings with real lives, and they're being demonized and criminalized in these states. It's time for California to stand up. I ask for your aye vote.
Thank you. It's a motion by Senator Wachowski. Madam Secretary, if you would call the roll.
This is SB 107 by Senator Wiener. The motion is that the Assembly amendments be concurred in. Umberg?
Aye.
Umberg, aye. Borges? Borges, no. Caballero? Aye. Caballero, aye. Durazo?
Aye.
Durazo, aye. Gonzalez? Aye. Gonzalez, aye. Hertzberg? Jones? Jones, no. Laird?
Aye.
Laird, aye. Stern?
Aye.
Stern, aye. Wachowski?
Aye.
Wachowski, aye. Wiener?
Aye.
Wiener, aye. You have 8 to 2.
All right, we're going to keep the roll open for 1 minute. So let's call the roll on the previous bill for those who weren't present to be able to vote.
This is file item number 2, SB 523 by Senator Leyva. Caballero. Caballero, aye. Gonzalez. Aye. Gonzalez, aye. Hertzberg. Stern.
Aye.
Stern, aye. You have 8-2.
All right, that bill's out. All right, let's go call the roll one last time on SB 107.
File item number 1, SB 107, Hertzberg. You have 8-2.
All right, that bill's out.